Hi. Okay, let's continue with another set of explanation for the knee. The previous discussion was on meniscus, if you remember, and today I'm going to explain to you about the ligaments of the knee. Ligament basically means a structure that holds bone and bone together. Knee consists of the thigh bone and the leg bone, that is femur and tibia. Between this thigh bone and the leg bone or tibia, there are 4 ligaments. 2 outside. This is the medial collateral ligament. This is the lateral collateral ligament. These 2 ligaments are outside the knee joint, holding these 2 bones together. And there are 2 inside ligaments, that is inside the knee joint. One is in front. This is known as anterior cruciate ligament, and another one is at the back. This is the posterior cruciate ligament. These 2 ligaments crosses each other inside in the form of cross, and that's why it is known as cruciate, cross ligaments. So the anterior one, the front one is known as anterior cruciate ligament, and the back one is the posterior cruciate ligament. The ligaments are important for stability. If you can imagine, these 2 bones are actually held together by these ligaments. If the ligament is torn, the bone will become unstable. It will be moving too much. So when will it happen? Injury to the ligament happens in sports, in motor vehicle accidents, and sometimes even fall. The forces that can cause the ligament to tear is either a rotational force like this, when the bones rotate against each other. For example, when you're playing football and somebody tackles you, the leg will rotate, and that is the time the ligaments can tear. The other one is an angular force. For example, if you're falling, when you're landing, for example, after playing badminton on smashing, and you land with the leg going sideways, this is an angular force, and that will also cause damage to the ligament, and this is when a ligament can get torn. Injury to the ligament causes a lot of pain, so presentation is usually pain, swelling, and immediately after the injury, patients won't be able to walk because of pain. Normally we investigate these injuries with MRI scan, because ligaments are soft tissue. This is not seen in the x-rays. So x-ray normally cannot show you a ligament tear. So we will proceed with MRI to see the ligament. In the MRI you can see the ligaments very clearly, and if the ligament is torn, we can pick it up. As far as the management is concerned, there is a fundamental difference between the inside ligament and the outside ligament. Any tissue, soft tissue, to heal, it needs blood clot. And outside ligaments, when it's injured, the chance of healing is very high. Most of the time, the outside ligaments heal by itself. Yeah? If the ligament outside is torn, most of the time the doctor will give you painkillers, rest, ice, and sometimes crutches. It takes about 3 to 6 weeks for the ligament to heal, but the ligament can heal by itself. You probably don't have to do anything. The process is, once there is an injury, there will be bleeding, there will be blood clot, which will connect the torn parts together, and the new cells will come and form the new ligament. This is the natural process of ligament healing. Unfortunately, same things do not happen inside the joint. If you can still remember, there is small amount of fluid inside the knee joint, and because of this fluid, which is important for the knee function, unfortunately this fluid does not allow blood to clot. So the inside ligament, once it is torn, there is no blood clot formation, and therefore the ligaments cannot heal. So when a cruciate ligament is torn, the tear is permanent. Although the pain can settle with painkillers, rest, and ice, but the knee will be persistently unstable. Patients after a cruciate ligament injury will come with a complaint of knee coming out or subluxating frequently, and they will have problem going back to games. When such thing happens, they will need operation. The surgery is actually to reconstruct the ligament inside. I hope my explanation on ligament injury helps you with the understanding of the knee injuries. With this, I conclude the video. Thank you very much and stay safe.